I see a lot of familiar faces from the last session, which is good because the transparency conversation is really appropriate and really nicely transitions into this data-driven regional decision-making panel that we have today. I'm Liz Smith. I'm a Gunnison County Commissioner and also the chair of Region 14, which is the Southwest Colorado Opioid Regional Council. And this conversation about data started a few years ago with really the question that plagued me is, how do we measure success? And what does that look like in a rapidly evolving epidemic where you're really trying to measure how much less you're losing? And it's harder to measure progress. And so, and I'll just give an example. When it comes to data, we have a lot of it. Does it mean that it's transparent? No. It's not necessarily easy to find, easy to access, easy to make into information that is actionable for decision making. And as a member of one of the state's child fatality review committees, I had noticed that in 1 year, we went from cases where there were almost no incidents involving opioids or fentanyl to nearly a third of the cases involving opioid or fentanyl. That jump in 1 year. And I was wondering, where is this data? Well, how can our council get it? Because it might impact where we direct our funds for things like safe storage. So this question really emerged out of what data already exists for the state. How could we construct an infrastructure that is statewide that all regions can use, regardless of how much individually our regions are getting, which can vary quite dramatically. And so today we're going to dive into this conversation about how this can be used for decision making with our guests, Dr. Lauren Gase and Hella Burnside. Dr. Lauren Gase is a senior evaluator at the Evaluation Center at CU Denver, and Helen Burnside is the director of Denver Prevention Training Center at Denver Health. Let's give them a warm round of applause.
Okay. Woo. All right. Thank you so much. It's really a pleasure to be here. Just a little bit more about myself so you kind of know where I'm coming from. My background and training is in public health, and I'm coming from a very applied space in this work. Before coming to the university, I was a practitioner working at CDC, working in local public health, and in nonprofits. And so my passion and my life's work for the past few years has really been in supporting organizations and communities to better leverage data to learn so they can improve both strategy, implementation, and impact. And so these are the goals of what we really want to do today. We want you all to leave with at least 3 new ideas for how you can use data and have some enthusiasm and excitement around supporting conversations within your region. We also have a secondary goal here. So the AG's office is really committed to supporting the regions with this work. And so we want to be able to gather your insights, your feedback, that help them determine the types of support that will help you all best in advancing data-driven decision-making. Some of you all may be aware there was a survey that went out a couple of months ago that sort of asked for a little bit of information about the types of information you were collecting, asked some questions about what type of support you would like. If you have no idea what I'm talking about, that's totally fine, don't worry. The results of what we learned today in this discussion will directly inform the types of support that are forthcoming. And so we hope to get your input and your buy-in for this statewide data system that we're looking to build. So before we go any further, we just want to get a quick pulse check of who is in the room. Can you raise your hand if you're a member of a ROAC, just so we can sort of get a sense of that? Okay, cool. Is your ROAC or is your organization in this work using data for decision making. So let's get like, yes, we're definitely doing that, sort of doing that, having some challenges doing that. Okay, look, a lot of enthusiasm, that's great. And are you doing this work yourself, or do you work with an external person to do this? Can I get a hand raise if you work with like an external person to do this? Okay, that's super helpful. Thank you so much. That just helps us understand. A couple of pieces just to clarify definitions so we're working from a shared grounding. We're gonna use the term evidence-based decision making today. Evidence-based decision making is really the intersection of the best available research evidence, decision makers' expertise, and community needs and context. It recognizes that research evidence alone is not and should not be the only contributing factor to the decisions that you all make. Other equally important factors include things like available funding, community needs, timeline constraints, cultural values, feasibility, right? It's really where that star sits in the middle, right? That sweet spot of where those three things intersect. It's underpinned by two core principles. The first is that the better the research evidence, the more confidence we can be in our decisions. And the second is that research evidence alone is never sufficient to make decisions. So, what do we mean then by evidence? I want to be clear that evidence is not what has always been done, right? So the best available evidence is really the weight of the evidence from the most rigorous studies available. And there's many sources of evidence, right? And I have some of those listed here on the slide. That's not meant to be exhaustive, but it's just more illustrative of the types of sources you may have access to and want to leverage. You'll notice that these buckets contain two types of data, both numbers, quantitative data, and narratives, qualitative data. So by rigorous, I do not mean only quantitative data. As all of us are probably aware, we can use numeric data in really misleading and inappropriate ways. It could have been collected in ways that are not rigorous. It could be reported and looked at in ways that are not rigorous. And on the flip side of that, there are ways to leverage qualitative narrative data, to collect it, to analyze it systematically in order to get insights that are rigorous. So rigor to me is using the best type of data to answer the question. And it often includes blending both quantitative and qualitative data. Some of the most actionable opportunities really come when you bring those data together, right? When you look at the numbers, when you make meaning of them, when you investigate and think about what do these mean. And this cartoon is pretty silly, but it really helps to illustrate the value of bringing those pieces together, not only to understand the what, but also to understand the why. And so, how can evidence be used? The last framing question I'll talk about. And these key points are summarized here on a handout. There's some on tables. If there's not any at your table, maybe look to a neighboring table. I have a couple more up here as well, so you can kind of follow along as I go through this. This is a framework that's actually been discussed a little bit in the last two sessions that have been in this room. So broadly, data can be used externally for transparency. That was the point of the whole last session, right? For those of you that were here, transparency. Cool, I am a huge fan of transparency. That's great. And data can also be used internally for learning and improvement, right? And both are important. And what we're really focused on today here is learning and improvement. I think data for learning and improvement is particularly important when we're trying innovative approaches to help inform pivots and to help inform adaptation. And I have heard all three of those things discussed throughout the day quite a bit. And so I think this idea of leveraging data for ongoing learning and improvement is key. So quickly, I'll go through these four buckets. Again, they're summarized on your handout. So I won't belabor this point too much, but the first bucket is for planning, understanding community assets, needs, opportunities, understanding promising practices, and making decisions about what and where to invest. The second is examining implementation. So this is really about understanding if and how strategies are being implemented, where there are both implementation challenges and successes, and to identify some of these pivots that are needed, and to lift up promising practices. The third bucket is about examining reach of strategies. And this is, yes, it's counting who participated, and it's a little bit more than that, right? Are we reaching our intended audiences? Are we reaching those most in need? Who aren't we reaching? What else do we need to do to reach those folks, right? And the last bucket is examining short-term outcomes. So examining if and how strategies are supporting our intended outcomes, maybe also identifying unintended outcomes, right? And identifying changes or things that need to be sustained. So I'm going to pass it now to Helen to talk about a great example of data that's been synthesized. That's a great resource for you all. And then we'll move into processing these things in a little more detail.
Thanks, Lauren. I'll take the clicker. Hi, everyone. I'm Helen Burnside. It's so nice to meet you and be here. I'm with the Denver Health Center for Addiction Medicine. We are an opioid innovation grantee, and just yesterday launched a project that we want to tell you all about today. Who we are, we were established in 2018 at Denver Health to coordinate essential services for people with substance use disorder in our system. And we want to be a compassionate model. And since then, we've built Academy Arm to help provide training and technical assistance throughout our state. You heard my colleague Brooke Bender mention this early today. We really have used in our own story here on the left at Denver Health the hub and spoke model. Raise your hand if everyone's familiar with the hub and spoke model. Yes, okay, so I've talked to several people who have not been, but the idea is the hub is a treatment program. For our project, we defined it as a methadone treatment program, and spokes are all those places. So on the left, we really did this internal to our system at Denver Health. We've partnered with our colleagues at the Northern Colorado Health Alliance who have done this across Weld and Larimer counties. With this idea, as we've seen a lot of evidence emerge from states like Washington and Vermont and California, that this could be a way to make limited resources work. And a comment made in the back of the room during the last session that many of us don't live, work, play, and have fun in the same county. I do that across multiple counties. So how do we ensure that people are getting the care coordination and treatment services when they want it, but also where they want it to? So this really formulated kind of our framework for the innovation grant, and the assessment is what we're going to be talking through today. We also are working on a toolkit next year on the hub and spoke model, and are providing technical assistance for correctional care settings related to MAP provision. So back to the assessment, we realized that there is a wealth of data available in Colorado. It is fabulous. I spend the rest of my day working in HIV and STI, and we have a lot of epi data, but not as much robust data that I've seen in this sphere. And so we really wanted to try and provide a current state snapshot of what is happening with substance use treatment. Oh, look, in Colorado. So we looked at all of these existing data sources that are everywhere from CDPHE, the buprenorphine dashboard, the overdose data dashboard, some behavioral health surveys that happen in our state looking at barriers to mental health care and substance use care as well. And we wanted to put that in one place. So we have these on the back table. We also put them out this morning if you were in the 8 a.m. session. But we have looked at this data on the county level, and we've batched all of that into the ROAC level for some of you. That is the same as county. For some of you, that is multiple counties. But we looked at these things. We tried to brainstorm with our colleagues at the Colorado Health Institute and Northern Colorado Health Institute what could be the best markers that we have available in data for community opioid status, and what could be these measures of access that might tell us where we have opportunity to focus on access. So for you all at the regional levels who are making decisions, thinking about how to put funding out, our hope is that this would start to paint a picture that maybe you hadn't seen before. So we decided just to show you on the slide our host region, Region 2, and I've been talking back and forth with Jared Olson, who I don't think is in this room, who's the ROAC lead for Region 2 about this. So this just shows you page 1. We tried to map the number of hubs, which we defined as a methadone treatment center. We certainly know there is a ton of innovation happening in our state that is beyond just provision of methadone. We don't have good data on that. So one of the things we hope to be back next year and say is to share some of those successes. And then spokes are all of those care coordination sites. This data comes from the Ladder database, which is where all of these entities have to be credentialed and certified by the state. So that's kind of where we got that data. And then we looked at some interesting measures. Spoke density. What does this look like per 100,000 population or per square miles? We don't really have a target for what our gold standard is, but we wanted you all to see this data too. And then on the second page, we provided data for county, the ROAC region, and then state. We did not do statistical significance because with all of these data sources, the denominator does change, which happens a lot with data. But you'll see you have the opportunity to look at where county buprenorphine prescribers are, where that compares to the region and to the state. Moving down, we tried to look at the number of those care coordination or spokes by the ASAM levels of care. We know that this is our true north and where we're trying to move. We also reported out on those community opioid status. Perhaps the best way to think about this with the measures we have, we would love to hear your feedback on this. And then measures of access to looking at in poverty, uninsured, without broadband. Broadband came about because I think we have a lot of folks thinking about telehealth and what this could look like. And I know that one of the grantees is Antelope Recovery is thinking about this on a statewide level too. And then we looked at barriers and reasons people could not get care, which come from existing data sources, as well as what the workforce looks like in your county region compared to the state. So these profiles are on the back table. I love that people are grabbing them. And we also have all of the data sources. Oh, I don't think I did that, but let's see. Okay, thank you. So we, in the month of October, are sharing these with the ROAC point of contact. Those should have hit inboxes on Friday, and we're seeking your input. But as Laura said, and as I know the AG's office is thinking about, is really how can we get data to you all? I see a lot of hands for those of you that are using third party, but hopefully this is a start of taking existing data and providing it to you all for just-in-time decision making. But over the next month, the email that we sent has our contact information for any feedback or questions that you all have. So we were asked to provide this example for evidence-based decision making, and we're really excited. Our next phase of this is we're sharing this with all of the 56 counties in the state that have a local public health agency. We surveyed for more qualitative information about barriers and facilitators to doing this work. We didn't get a lot of responses to our survey, so we're gonna try that again. You might be hearing from our team of trying to really figure out where you've had success in your region, so that as we build that toolkit in year 2, we can consider that. We would also love to hear from your region if you've considered a hub and spoke approach or may wanna move towards that as well. The other thing I just wanted to mention is I think every time that we talk about data, making informed decisions, and I love this slide that we started this session with about it's not just the numbers, it's also the lived experience. We at the Public Health Institute at Denver Health came up with data equity principles. So every time that we're presenting epi data in the community, we share these principles because we realize that with every number, there's a life, there's a family that may have been broken. There's more to the story that we're not going to get just with the numbers on the profile that we showed you. So I'm not going to read through these for you all, but I would just encourage us all to think about, as we use data for decision making and we're taking data to the community, how do we also acknowledge the lived experiences that happen behind each number? And how do we also create space for those stories to be shared, whether it's the gallery of photos here at the conference. I think that we, as data and program evaluation folks, have an extra sense of responsibility in this work to make sure that we're eliminating bias, which we'll talk about through the activity today, but to also make sure that we have room for the experiences and stories to happen behind the numbers. And we also need to recognize the role of racism in all of these numbers too, and the different disparities that happen for Black, Indigenous, and people of color. And how all of these factors, I know you all know this in the room, are tied to other systemic factors. When we report this data in the community, we always bring this back because there's still so much stigma about people's individual behaviors and bad behaviors being made. So I also think we have such an opportunity to continue education about the factors that influence health when we're presenting numbers and using data for decision making. And also really thinking of that systems level and strength-based approach. So this is another one we really talk about when we are presenting data in the community, those factors that are upstream, however you want to talk about those, to avoid that judgment on the individual. And then I think I have another fancy graphic that we do well here with the opioid abatement funds, is really using that lived experience. But I think this is really a new thing for public health, for healthcare, and for us to do in the community. So I just wanted to share those. I'm happy to, I have my contact card, share those with you all. We would love for you to take these and make them your own in your regional council and use these as you're out in the community too. We found it really rewarding and starting a lot of conversation about the numbers and the experiences, and it feels really helpful to be able to have those conversations with the numbers. So we are going to start a little activity with some dimmer lighting. Do you want to set this up, or do you want me to?
Sure. Can we make it a little bit brighter in here? I feel like this is the exciting enthusiasm part, and so we don't want to be going to sleep. So maybe we'll work on that. So what we're going to do is we're going to ask folks to stand up, I think, and get into a group of 2 or 3, preferably maybe with someone you don't work with, meet a new person, and take some stickies with you. There's some on the tables. If you need some more, I have some more up here. There's also a couple pens. If you need some pens, also please come grab some. And you're gonna go to one of these 4 poster boards that are around the room. We have plan, examine implementation, examine reach of strategies, and examine short-term outcomes. It doesn't totally matter where you go. You can just start on one of them. And we're gonna ask you to discuss with your small group what's going well. What data sources are you currently using for this bucket, right? And how are you using data for this type of work? So there are some, by the posters, the 2 posters are exactly the same. There's some questions on there. Again, this corresponds with what is on your handout. I feel like maybe something was in my water. Hopefully it's not just me. There's some, yes, all right. Woo. All right, there's some questions on the poster as well to kind of help give you some ideas, right, about the types of questions that might be in this bucket. So on the blue, just write down a couple ideas, right? What's going well? What are you doing? How are you crushing in this area? And on the pink, some challenges. Where are you running into challenges? What else do you wish you knew and could find out? Start with, 1 or 2 people. Go to one board. Once you finish that conversation, go to another one. Meet someone new, right? This is meant to be kind of interactive. We'll give some time for this activity, and we'll call folks back and maybe hear a couple key takeaways and wrap up. Before we do this, any questions on anything we've presented, reflections anyone wants to share? Okay, look at this. This is great. I know. End of the day. Woo. All right. So stand up, get loud, find some friends, someone you don't know, ideally, and have have some great conversations. couple more minutes for folks to finish up, add any additional thoughts to the poster boards, and then we'll bring it back together to hear any reflections, questions.
All right, we're going to ask you to make your way back to your tables. You can certainly put a sticky note on your way out. We love the conversation that's happening, and I can't wait to review all of the sticky notes. So now we want to hear from a handful of you all, maybe 5 of you, about this activity. You're welcome to share a success or maybe a sticky point, but any reflection on conversations that you had on the presentation or anything about your evidence-based decision-making from this whole day. So just raise your hand and we'd love to hear from a few of you and we'll bring you a mic. Reflections, questions.
Something you heard that gave you a new idea? Great.
So we only got to 1, the plan, but we had great conversations. And for me, running a statewide recovery community organization, the thing that we have going well is that we've got to know the communities and the needs of each community, because each community has different needs, through using surveys and data to really help us track where we can go next, and then getting into the communities and actually asking the community what those are. The downside of that is that opposite part. You get into some smaller rural communities, it's really hard to get accurate data, number 1. Number 2, because of the stigma and discrimination that are already in those communities. And that's about as far as we got. My other people that were with me are welcome to talk about what they came up with.
Yeah, great point too. I think when we think about the smaller denominator and smaller size, how that impacts the data we can gather. Thank you. Others? I think we might have to just give the mic to someone, Lauren.
Ooh, pressure.
The power of the mic.
That's like terrifying for me too. I'm just gonna start walking this way with the hopes that someone raises their hand to share. Yes, nice. Just any takeaways, something you heard that gave you a new idea, or something you want to lift up.
Yeah. No, I think one of the things that came up for us, we spent a lot of time over here by the correctional care topic. And I think one of the big things that came up is data sharing and how hard it is. Even with it, I work for Denver Health, and we have an internal system, and even data sharing within a system is challenging, but then across systems is really challenging. So one of the questions over there was, what metrics would you want to know? We want to know how many patients link to care post-release, but we only have information for our own organization. We don't know whether they're linking to other organizations upon release. And so that's the kind of thing where that data sharing is just so important.
Great point. I love that. And I think that's one of the things that is top of mind as we're going into this work is how do we leverage information systems that are already available? How might we link information systems securely and safely in a way that does support greater understanding? Great point. Yes.
I feel like my conversations really inspired me to think about how to make data more accessible from a reporting standpoint for folks who use screen readers and to make sure things are 508 compliant, and just kind of grappling with the immediacy of wanting to share data once you have it, while also making sure like we're all doing our due diligence and making sure everyone can read and understand the data. So I think that's a line that I'm always kind of trying to toe, is how to balance that urgency of getting the information out there with also making sure it's in alignment with making sure everybody is able to access it.
Great point. Thank you. All right.
Behind.
Thank you. So it's sort of a double-edged sword, and the true expert on this topic is sitting at the back table, and if she wants to say anything when I'm done, I would defer to her. But there's something called PIMS reporting, Performance Improvement Measurement System, that are federally required if you have a federal grant to submit every 6 months. And it's quite an undertaking, I have to say. But the benefit of it is at the end of the reporting period, you have all this really rich data. And so then we can take those data and we can post them on a data dashboard. And so it's a really nice exercise, and because Maddie's so good at it, I don't know if you want to add anything.
Sorry, I'm kind of losing my voice here. But yeah, Terry and I, for our HRSA grant, we submit PIMS data every 6 months. And I think just kind of reflecting on that, the greatest challenge is just recruiting data from all these different sources, and the methodology of collecting that data is so different from a rural hospital to a treatment facility. And so finding ways to sorry, I'm getting over a cold, to really like bring those together and to figure out and work with all these different stakeholders to create the most reliable report can be really challenging.
Yeah, I think one thing that you said that I just want to lift up that I think is really key here is it's about the data, but it's also about the reviewing and the meaning making and the so what. Right? And so thinking about that as a cycle in terms of what's the actionability here, and starting with the actionability, right, makes that process then a lot easier. Sometimes, and this is why I mentioned at the beginning, there's kind of those two big buckets, right? Accountability and then sort of learning and improvement. Sometimes the data points that can serve both of those goals are the same, but I'll be honest, sometimes they're not. Right? And sometimes there's things you want to look at internally for different purposes for decision making. And I think that that's okay and totally appropriate. And so when you're thinking about, from a big picture standpoint, the types of information you want to gather, I definitely encourage that accountability lens for sure. And don't forget about yourself, because I think sometimes it's easy to just have data for someone else, when we really also should be thinking about what are the key questions that we need, what decisions do we want to make, how do we make sure that we're learning and improving. So I think with that, maybe I will wrap us up. As I mentioned before, this is meant to inform next steps with the work, right? The AG office wants to support you in this work. And so one final thing on your way out, there are a series of like cut up dots on top of that water bottle. They're like in packs of 5. And you can use that to vote. There's different categories of types of support, data related support that you might want. Take one of those dots. You could put all 5 on one. You could spread them around. This is a rough way to collect data, right, on what you want, what kinds of information, what kinds of support would be most helpful to you. There's also an other bucket. So if you want to write stuff on stickies, you want to tell us something about what we should consider, write it down, throw it up there. And we will take all this back to the AG office as they identify the next steps to support the regions.
And just to clarify, how many votes do we get? One.
They're cut up into packs of 5.
Okay.
So just
you-
take like one of
5
the
votes.
packs. Don't take 2. That's not right. No election issues happening here. So just take one. And yeah, just put it on there. Vote how you want to vote. Yeah, and we'll stick around in case there's any other questions.
Yeah, and the profiles are on the back. There's our contact information. Thank you all so much for the work that you do in our communities and to advance this work. We appreciate you. Do you have any announcements?